It's important to note the word prevent. We cannot prevent a food allergy, but rather our goal for nutritional intervention is to reduce or minimise the risk of an adverse food response in a patient that is diagnosed with a hypersensitivity. As mentioned previously by my colleague, a food allergy is due to an immunological response to glycoproteins present in the diet. It is dependent on the molecular size of the protein that requires a previous exposure to elicit the reaction. Thus, the key nutritional aspect is a thorough diet history to know past exposures to avoid these in the future, and most of all, to be diagnosed with a food allergy first. Without a diagnosis, simply avoiding certain foods or food groups or rotating the diet regularly will not prevent an allergy. If you suspect an allergy, it is important to perform a strict elimination diet trial with a provocation test. This allows us to know what ingredients should be removed from the pet's feeding regime. It is also important to feed a complete and balanced diet based on the correct proportions of fat, protein and carbohydrates, as well as vitamins and minerals. In a type 1 hypersensitivity reaction, the protein must penetrate the mucosal barrier of the gastrointestinal tract to induce IgE production. These resultant IgE bind to a mast cell and then sensitize them. It is the size of the protein and its ability to then cross-link these IgE molecules on the mast cell to release the histamine, and that determines the allergenicity. Certain proteins are considered more likely to induce an adverse response than others. However, it is based on the individual's previous exposure, and this can vary from countries and regions. In a 2016 review of all the literature, the most common food allergens contributing to a canine cutaneous adverse food reaction were found to be beef, dairy, chicken and wheat. In cats, it was found to be beef, chicken and fish products. Carbohydrates are typically not a concern as an allergen, but the protein in carbohydrate-rich products, such as wheat or soy, typically used in manufactured pet food, can be responsible for some animals. It has been estimated that wheat and soy are responsible for 13% to 15% and 16% of adverse food reaction in dogs. Similar to humans, gluten intolerance may affect some dogs, however, is very rare and is only being described in two families of Irish setters. There is also some evidence that the processing technique of the commercial pet food products may influence the antigenicity of dietary components, such as heat treatment that can change protein structure, as well as the epitopes, and potentially affect the host response to that ingredient. An elimination diet can consist of a home-cooked diet or prescription veterinary therapeutic diets. These contain a unique protein and carbohydrate source to which the animal has not been previously exposed. The goal of the elimination diet is to reduce the allergenicity to investigate the underlying cause of the clinical signs. Diets include hydrolyzed protein diets or novel or also limited ingredient diets. A hydrolyzed diet is made with proteins that are chemically broken down to the level of the amino acid. This amino acid is the building block of the protein. These are less likely to trigger an allergic response as it prevents or minimises the risk of binding the mast cell, IgE, on the mast cells. Hydrolyzed proteins are a good choice for dogs and cats that have been exposed to a variety of foods and treats, or when the history of the diet is not fully known. Some animals may or may not like the bitter taste of the hydrolyzed protein and can also be cost prohibitive for owners and not an ideal choice. Limited ingredient diets are those based on one protein and one carbohydrate source ideally, or a novel ingredient diet are those formed with protein sources that the animal has not been exposed to. The immune system then cannot react to these ingredient sources and reduces this risk. The success of a novel ingredient diet is knowing the thorough diet history. A novel protein is novel to the individual and not for all animals. It has potential though for the animal to have an immune reaction in the future to this ingredient, as it did in the beginning. Once the offending food allergen has been identified, the goal is to avoid the ingredient in the future diet, including treats and supplements. Veterinary prescription diets, including those hydrolyzed diets and those indicated for elimination diet trials, can be used in the long term if they are formulated to meet the nutritional requirements of that specific life stage in dogs and cats. Owners can transition their pets to non-prescription diets as long as the formula chosen does not contain that known allergen and they are also complete and balanced. However, it is important to note that the literature has found these over-the-counter diets may contain ingredients that are not listed on the label. Thus, these contain potential antigens and could induce the presenting clinical signs. Patients should be monitored for evidence of this recurrence when the diet is switched over. If a home-cooked diet is chosen as the future long-term diet, it needs to be formulated by a boarded nutritionist. This is to ensure that all the nutrient requirements are met and no deficiencies or toxicities occur. Lastly, with all diets, the appropriateness should be re-evaluated throughout the patient's life to ensure that in case there is a comorbidity, is the diet appropriate for this disease?